Hello, everyone. Happy Tuesday, and welcome to March's Family Council Empowerment Hour with my colleague Gloria Murray and I. And we are really, really stoked, psyched, excited, um, just happy beyond words to have a welcome and present our colleague across the ocean, Sam Peck from Family Councils Ontario in Canada. She is brilliant. She has a presentation to share with us today, and it's simply about family councils. We know that many of you are still figuring out the ins and outs of family councils. What does a family council look like? How to build one, how to maintain one, who to start one with. There's so many questions, and Sam is here to help us answer them for you today. Welcome, Sam.
Thanks so much, Janine, Gloria, Haley. I'm very excited to be here with you today. I am going to share my screen. If I can just, Janine and Gloria, is that coming through?
Yes.
Yeah. All right, wonderful. So thanks everyone for being here today. So I'm Sam Peck, my pronouns are she and her, and I'm the Executive Director of Family Councils of Ontario. I'm going to tell you a little bit more about who we are in just a moment. But the gist of today's presentation is I'm going to tell you from the Ontario context how our councils work, talk about some of the transferable learnings and best practices that you can use to support family councils wherever you're located. So I am going to talk a little bit about FCO, just so you have some context about where I'm coming from. I'm going to tell you about councils and their characteristics in the Ontario context. Going to be some things that are unique to our area, a lot actually, that you can transfer to your context. I'm going to talk about powers of a family council, and both in terms of what our councils have the legal power to do, but also really what the power of the collective impact is of a family council here, and some of the benefits that we see and how you can build those in your community. First, I have a few poll questions. So if Haley can launch those for me, I really want to know a little bit about you. So we've got, how did you find out about today? Where are you joining from? I'd like to know a little bit about where are you right now and what your connection to family councils is. So for the connection, are you a current council member, a family member, or a caregiver, but not currently engaged with the council? Are you a long-term care or nursing home staff, an ombudsman, or other? It really helps me to know a little bit more about you. And just as we go along, while you're doing that, I'll be answering questions mostly at the end, but also keeping an eye on the chat as we go through. So feel free to use the chat or Q&A. And I will get to as many of the questions as we can today. Might be some things I have to defer to the team. Things specific about New York State, can't tell you much about that, but feel free to ask questions about best practices, getting started, maintaining councils, and how you can work effectively to support the residents of your long-term care or nursing home. So Haley, I'll leave it to you to close the poll when you think enough folks have contributed, and then put up those results. And everyone, final seconds to chime in. If you missed and you want to let me know in the chat, that's okay as well. All right, so we have an entirely American audience today. That is actually really fun for me. Most of you are in New York State, some elsewhere in the USA. Looks like your newsletter or other communications channels work great, Janine and team. Most of your folks are joining through there, but also Facebook and through a local ombudsman. Okay. Oh, we've got a lot of people from the Ombudsman's office here today. That's fantastic. You can use your influence to support family councils. And then we've got a good number of current members and caregivers, but not family council members. Okay. So that's really good to know. Welcome to wherever you are joining from in the US. And I'll give you a little information about Family Councils Ontario, or FCO, as we call it. So I'm joining you today from Hamilton, Ontario. So on the left, you'll see a map of Canada, and then on the right, Ontario. Ontario is a pretty big province in terms of landmass, but also most of the population actually lives in Ontario. So I am coming to you today from a little, see if I can, little area right here. That red glowing dot is. So just on the western side of Lake Ontario in southern Ontario. So that's that. But we work with councils all across this province. So all the way from, say, Chatham and Windsor, which is across the street from Detroit, or across the river from Detroit, all the way over to Thunder Bay, which is close to the US border, and then all the way up to very northern Ontario. So it's a big, big province. Family Council of Ontario, we are a charitable, not-for-profit organization. We've been an independent organization since 2015. Before that, we were a program of another charity, kind of what you'd call fiscal sponsorship in the US. We are funded by the provincial government. For those who don't know, provinces are like states. So through the ministry, our Ministry of Long-Term Care. We serve all 600 plus long-term care homes in Ontario. You may call them nursing homes or homes for the aged. Now in Ontario, we refer to them all as long-term care homes. In the 1990s, and how family councils started, is residents living in long-term care were becoming increasingly impaired, living with complex health issues, high degrees of cognitive impairment. Right now, over 80% of our long-term care residents live with some sort of cognitive impairment, like dementia or something similar. And family caregivers started gathering together to advocate for residents. We had residents' councils, but families came together to say, many of our residents, our loved ones, can't speak for themselves. How can we advocate for them? And family councils were formed. Because of the recognition that there needs to be some organization or some way to support these councils, a pilot project was established in 1998 to support family councils in the Greater Toronto Area, or GTA. Also, again, that's where most of the population of Ontario is, in Southern Ontario, and particularly in the Greater Toronto Area. So then in 2004, this was after the pilot project got funding, like extended funding, we got government funding. At the time, we had 2.5 staff, 2.5 full-time equivalent positions. In 2015, we grew to an independent charitable organization, and now we have 7 staff. So we have 7 staff that support over 600 long-term care homes. So we tend to be pretty busy. Our mandate is to lead and support families in improving the quality of life in long-term care. That's our mission. And our vision is that people in long-term care have a vibrant experience and the best care. That's a vibrant experience for residents, caregivers, home staff, volunteers, visitors, and so on. We seek to cultivate effective family councils to help them develop and nurture strong relationships, and to create effective councils. We also do a lot around public policy and system planning to inform policy at a provincial government level, mostly, but sometimes federally. And we do a lot around knowledge exchange. So research, We participate in research projects. We create resources with our partners and more. We don't work alone. These are some of the other Ontario-based organizations we work with. We have an organization called the Ontario Caregiver Organization, which supports caregivers across the spectrum of care, age, disability, illness, and what have you. Ontario Association of Residents Councils is like our cousin organization. They support residents councils in Ontario. Advantage Ontario and OLTCA are provider associations. For OLTCA is specifically to long-term care of all operator types, not-for-profitable, charitable, and municipal. Advantage Ontario works with the nonprofit and municipal side, long-term care and more. Work with Ontario Health, the Ontario government, and we have a great organization called the Ontario Centers for Learning, Research, and Innovation in Long-Term Care. They're kind of like a center of excellence. So check out those if you want to know more about long-term care in Ontario and how different organizations work together to support a healthy and vibrant system. We do a lot of consultations with family councils. So I'll abbreviate family councils as FCs, and LTCH is long-term care home. And so we work with councils and staff, provide information, help solve problems, address conflicts. We have coaching, mediated conflict resolution support, peer support, and networking opportunities. We do a lot of education and training, and we do a lot of webinars and have 2 virtual conferences a year. So we, once again, we're pretty busy. We do a little bit on the Ontario context. This does provide some information about this. So as I said, we call them long-term care homes, maybe called nursing homes or homes for the aged. And for Ontario, it's defined as residential homes that provide ongoing care to patients whose care needs can't be met in the community. So this could be because of advancing age, disability, or declining health. Family caregivers, I tend to use family member or family caregiver as a bit of a shorthand. Really, that includes family members by blood, marriage, choice, or a friend that provides unpaid caregiving support. It can be hands-on, emotional, social, etc., and that's care to a long-term care resident. Healthcare in Ontario, we have universal healthcare with an asterisk, and that long-term care isn't in that, it's paid by the resident. If they can't afford it, there are rate reductions. So cost is not a barrier to receiving long-term care in Ontario. Healthcare is a provincial responsibility, except it's federal for certain groups, First Nations and Inuit and veterans. And healthcare is mostly delivered by the provincial government, but it's financed with general revenue raised through federal, provincial, and territorial taxation. So you probably hear Ontario or Canada's got universal healthcare. We mostly do, but there's some asterisks there. So in Ontario, we have over 640 homes, regardless of what we call operator type, which could be municipal, surrounded by cities, not-for-profit, or sorry, I should say for-profit operators. They're all subject to the same legislation. In Ontario, that's the Fixing Long-Term Care Act. They're also all subject to Ministry of Long-Term Care oversight and inspection, and they are funded as per the same model. So regardless of the type of home, homes get the same amount of money, done the same way per resident, etc. Eligibility, we think of nursing homes as mostly homes for seniors. Most people living in long-term care in Ontario are over 65, but eligibility is as young as 18 years or older. They have to have a valid Ontario health card and healthcare needs that can't be met with any combination of caregiving in the home or community. So home care isn't enough, and their health needs can be met in a long-term care home. So this is just a little bit about the residents in Ontario. So 1 in 13 Ontarians will be over the age of 80 by 2040. So, and we have a population of 15.5 million in Ontario. of the over 30 million for Canada. The population is, the 80+ population is projected to double by 2040. We have a rapidly aging population. Nearly 3 out of 4 caregivers worry that they can't handle the current caregiving needs of their person. And they deliver about 39 hours of care per week. So that's distressed caregivers, which is more than double those who are not distressed. So we have a bit of a crisis in Ontario. But part of the benefit of family councils is they can help alleviate some of that distress when someone moves into long-term care. So for those in long-term care, 3 out of 4 people have 3 or more different medical conditions. Over 88% require support with activities of daily living. That was compared to just 67% in 2011. The resident population in Ontario is getting older, frailer, and sicker as they move into long-term care. What that also means for families and how family councils can support is caregivers are more likely to be in distress and to be sort of at the end of their capacity by the time their person moves in. 75% of people entering long-term care are on 8 or more different medications. 30% require 13 or more. Long-term care is a complicated, still highly medical place. And over 75% of people have mild to severe cognitive issues. So we have an older, frailer, and cognitively impaired population. By the time families get to long-term care, they're at the end of their rope, they're distressed, they're burnt out. But family councils can help with that transition into helping that family become part of a new community. It's really where family councils have the power to make a difference in someone's life. So I said in Ontario, they've existed since the 90s and supported by Family Councils Ontario. And I said they're also recognized in the legislation in Ontario. And this is something that's actually quite unique to Canada. Other provinces have combined family and resident councils. So for example, the province of Alberta and British Columbia. So Alberta is in the prairies, kind of in the middle. BC or British Columbia is on the west coast. They don't have the same powers given to them in legislation like we do. Ontario's been ahead of the curve for a while. So in Ontario, each home may have a family council. It's may because you can't force families to meet. Can't say you shall have a council if the families don't want to or don't have the capacity. So our councils have powers by law, with specific powers given by what we call the Crown, which is really the federal government. There's a loose definition of membership in legislation, really to prevent councils from being taken over by home staff. They're really buy-in for families. The home has duties to support the council, and there are very specific rules about staff interference in the council. So the Ontario government was very deliberate about ensuring that councils are buy-in for families, and they have the autonomy to consider how best to carry out their work and what they want to focus on. And that's also something that's really powerful, is our legislation gives and empowers families to set their own goals, to decide as a group what they want to focus on. And I'll talk about that a little bit more as well. So how do we define a council? And it might be different for how it is in your jurisdiction. So in Ontario, we define a council, a family council, as an organized, self-led, self-determining, and democratic group composed of family and friends and persons of importance to the residents of a long-term care home. So all councils are different, but they do have characteristics in common. They make decisions in a democratic way. It's not one person's council. And it really is families and friends. Persons of importance is a term taken from our legislation. And it's really, if you don't meet the definition of family, then you're someone who's important to a resident. So for those on the meeting, does this resonate with you? Like, do you have any feedback or that? Feel free to like drop something in the chat if you have thoughts about how that may resonate with you. Like, does this sound right to you? Or is there something that in your experience you would add or change?
I can tell you, Sam, I love this definition of a family council, and I know it resonates with Gloria as well. We both actually love it, and we've kind of adopted it as a way to explain what a family council is. We love that democratic group of composed of family and friends. And that is what the regulations say for family councils here in the United States. So thank you for that.
Excellent. So this might also resonate with you folks as well. So councils are all different, but they come together and interact with one another regularly. They share a sense of belonging or purpose. They have common goals and objectives, and have some degree of structure, rules, and methods of operation. So unlike what Cynthia's pointing out, where in their home, it's mostly controlled by management because no family member wants to run it. Remember, just harken back to what I said about a home may have a family council. So in Ontario, if the families don't want to have or to run a council, then the home may not have one. But to Rita's question, we estimate, we're not a membership organization, it gets a bit hard to know exactly what percentage of homes have a council, probably about 80% at any given point in time. So you're probably looking that about 450 to 500 homes have a council. Now, they're going to be at various degrees of or various stages in group development. Some may be just starting, and often when they're starting, they have more home support to get them really up and running. But in Ontario, it would actually be interference for management to control the council. So that's a really important thing for our groups, is the legislation actually precludes management and home leadership from deciding on the goals and objectives or deciding on the purpose of the council. So Cynthia and Rita, I hope I answered your questions there. And some of those characteristics that support comes from the Fixing Long-Term Care Act, or as we call it, FLTCA. And so that's the legislation governing all long-term care homes in Ontario, all nursing homes. Doesn't matter where, what size, who operates it, all subject to the same legislation, which came into effect in April 2022 and replaced the Ontario Long-Term Care Homes Act of 2007. That 2007 legislation was the first act that gave family councils power, that recognized the importance of them in Ontario and gave them powers and outlined how a home has to support them. So that was a really, really big deal. 2007 actually came into effect in 2010, but we've got 14 years of legislated family councils in Ontario. And so they have been able to execute their powers. So in legislation, councils can provide assistance, information, and advice to residents, family members of residents, and persons of importance, including when new residents are admitted to the home. So what that often looks like is that, I'll get to membership in a second, Charles, is that, let's say I'm a new person to Sunnycrest Long-Term Care Home. Chances are I've come in, I'm kind of overwhelmed. There's not enough information given to me as a new family member to long-term care. I don't know what to expect. But the family council could be there for me. You know, Janine and Gloria could say, you know, welcome to the home. Here's some information on how things work. Here's who you talk to. It's really that insider information and advice. Could be things like, you know, here's how often your mom's going to get a shower. Here's, you know, how often there's these sorts of events. You know, did you know that, you know, here's who you talk to about laundry, things like that. They're really valuable insider information. And they also have the right to advise, or the power to advise residents, family members, persons of importance about the rights and obligations under the act, the legislation, including what we have is called the Residents' Bill of Rights. Certain rights residents have to get information, to be free from abuse and neglect, to have privacy, and so on. They also have they can also attempt to resolve disputes between the licensee and residents. Usually, this takes the form of advising the licensee of concerns and complaints, which I'll get to in a moment. This is really related to issues around quality in the home. Councils also have the power to sponsor and plan activities for residents and collaborate with community groups and volunteers for that. So this is a really powerful thing councils can do, because families often act as a liaison or a conduit between the broader community and the home. So for example, something that happens with our groups is, let's say there's not enough entertainment or activity on the weekends. Staffing levels are lower, residents might be looking for something to do. Council could hold an activity. Let's say there's a particular ethnocultural group that that the home mostly serves, let's say, in Ontario, French speaking. There's actually a long-term care home in the Toronto area that has a unit that is French designated. So council could say, there's not enough French entertainment coming in. Let's work with this group and get something in once a month or so. They can collaborate on that. Councils also have specific powers to review certain aspects of the home. So when there's an inspection, and that's when the provincial government comes in and says, is this home in compliant? Is the home compliant with legislation? So they get inspected. It could be from a complaint. It could be what we call a more general inspection, where they look at everything, or a complaint with a specific thing. So council gets summaries of those inspections. They get from the home written plans to achieve compliance. They can also look at the detailed allocation of funding. So what comes from the province, what is like a resident copay. And they can also look at the audited financial statements of the home, and more broadly, the operation of the home. Are there issues with, I'd say staffing, but our entire countries in a health human resources staffing crisis? I think actually most of the world is right now. But let's say it's an operation around the right kind of personal support workers, like their skills and expertise. Some jurisdictions might call those nursing aides. The council could also say, we're not doing enough around palliative care education. So there's all sorts of things that a council can look at and say, here's a problem or a concern or a recommendation. How can we work with the home to make something better? It doesn't mean that councils here get involved in, HR decisions or budgets of home departments. We have to let management manage the home. But council is another set of eyes and ears about what can we do better? How can we make this home an even better place to live, work, and care? So those powers are really important. And because they are, given by government, by what we call the crown, which is government, a home can't take that away. A long-term care home administrator couldn't say, no, you can't do this, because that's interference. So councils have really amazing powers with backing of law to come together as a group to improve the lives of residents and staff and caregivers, and really work with the home to ensure that they're compliant with legislation. The legislation in Ontario is thorough, for lack of a better term. Long-term care is actually either the most or the second most regulated industry in Ontario, at one point second only to nuclear power. So it is regulated. if you're ever snowed in on a Friday night and you want to read something, you can find the entire Fixing Long-Term Care Act online. It's quite long. It'll take you some time. Before I get to benefits, I'm going to stop and look at the chat. Charles is asking, to be a member of the Family Council, must one currently have a resident in the nursing home they are caring for? It's an excellent question. So in Ontario, membership for a family council is a family member or person of importance to a resident. Now, that person of importance phrase allows for what is in Ontario called current or continued membership. Let's say I'm a family council member. I've been a family council member for a while. Say my mom's in the home. When my mom passes, I can continue to be a member of that family council. My membership is continuing, provided that the council, they're self-directed, they're self-determining, provided that they provide for that continued membership in their terms of reference, their bylaws. To join the council, you need to be a family member or person of importance to a current resident. And also our legislation prohibits certain people from being on the council, which is really home staff, people in government that have oversight over family councils, really to ensure there isn't undue influence by the home or others on that council. And to be a family council member, let's say let's say I'm a staff person at the home my mom lives in, I still can't be a member of the council because the right to be a member is subject to the list of who cannot be a member. So yeah, it would not be like what Haley's pointing out. It's upon invitation. So others could attend a council meeting. They wouldn't be members, but they could attend upon invitation. And because in Ontario, residence councils are separate, they are only for residents. If a family council member wanted to attend a residence council meeting or vice versa, there has to be an express invitation to preserve the integrity of each group, really. Okay. Oh, clicked the wrong thing. So I'm just checking the chat again. Do family councils in Ontario assist residents who want to go home getting home? In Ontario, is the right to return home and age in place recognized? So family councils here wouldn't get involved in that. What we call placement coordination, where someone's going to go, whether from hospital or home, is run by what is called home and community support. I'm going to call it home and community supports. The names of things here change pretty frequently. So there are specific placement coordinators who assist with that. So that is not something family councils would do. The vast majority of residents who move into long-term care, that'll be their final home. We do have home care. It's usually not sufficient for people who have high needs, like long-term care residents do. So, and then just to Richard's point, so in Ontario, even here, residents don't have an automatic right to attend family council meetings. It's still upon invitation. Okay, so we know what councils are. We understand kind of what their powers are in Ontario. So then sort of so what are the benefits? And I'm sure that, and I welcome you to jump into the chat and tell me what you think the benefits are of being in a council. And what I hope is that what I'm going to explain on the next slide really resonates with you. But feel free to jump into the chat and tell me why this matters. Why do councils matter to people? Because I'm definitely happy to hear from you. This is what we see in Ontario. Family councils are great because families have somewhere to go with questions. For the vast majority of us, we don't have a lot of exposure to long-term care. Honestly, before the pandemic, before COVID started, and in Ontario, the vast majority of the deaths in those first 2 waves of COVID were long-term care residents. Over 5,000 residents died in Ontario, at least 5,000 of COVID-19. So for a lot of us, the pandemic was really what put long-term care into the spotlight in the media, and in sort of the social consciousness. But we still, unless you're exposed to it, don't really know a lot about it. So families and friends have that insider knowledge. So new folks, new caregivers to long-term care community can go to a family council meeting and just hear from others how things work, who to talk to, get their questions addressed. It is a really valuable place for that hidden knowledge. Councils also improve the relationship between family, staff, and home administration. It helps because building on families now have more information about the home, about the sector. They can ask good questions. They can give good feedback to the home. And an effective family council, one that is self-led, manages group dynamics, understands the legislation, and understands the home as a whole, that also demonstrates to home leadership that families care and they want to be engaged in the life of the home. So effective councils benefit families by having positive relationships with home leadership. It's also really important for peer support, not just the information and the knowledge, but also to say things like, I'm struggling with this, I'm having a rough time, my dad doesn't recognize me anymore and I don't know how to deal with that. Just having a place to share those feelings, those emotions, and those thoughts really helps people through the long-term care journey. And it's often quite jarring moving from hospital or community into long-term care, because it is different. And we, as I said, families often don't know what to expect beforehand. Family councils are also really important to provide an opportunity to learn about home operations, policies, and procedures. So, Janine saying families coming into long-term care don't always get a good orientation from the staff. Admission day in Ontario for new families is overwhelming. They think they're going to be there for a couple hours filling out paperwork. It's like an all-day thing. And it's still not what families really wanted to know about long-term care. It's overwhelming paperwork. So having someone to help, guide you through that transition is incredibly valuable. And if you don't always get, sort of the Coles notes in advance, some folks might be too young to remember what Coles notes are, but like shorthand, like a summary. Too long, didn't read. Family councils provide a great forum for learning about, let's say, foot care or wound care in long-term care, or laundry, or how menus are planned. Someone from within the home can come and speak about that, or about palliative care education. It could also be an opportunity to learn from external experts. So having the Alzheimer's Society come in to talk about meaningful visits, could be caring for the caregiver to help families through their journey. And it helps to identify shared issues and to enable families and friends to speak through a shared voice. So often the way that happens here, and I hope this resonates with you as well, is let's say we're a family council. A lot of councils do meet by Zoom right now, so this tracks. And let's say I bring up an issue. It's like and I always apologize for picking on laundry and dietary staff, but two of the biggest issues in Ontario. Let's say it's something like my mom's slippers have gone missing again. I don't know why this is so hard for them to remember that Kathy's slippers are the purple ones. They have her name on them. So it's really upsetting to me. It might seem like a small thing, but it happens over and over and over again. It'd be really difficult. Now, if we open it up and say, does anyone else have this experience? And let's say that Janine and Ira and Susan, you're like, yes, I noticed that too. We can then as a group decide if we want to take this issue on and advise the licensee, the home leadership of this problem. Then we make it a shared issue and communicate with the home and try to figure out how to resolve this. On the flip side, if it's only me, everyone else is like, I haven't really noticed this. It's not a problem for us. It's not something our councils would take on as an official council complaint or recommendation. But because councils are also great for peer support, you could say to me, that sounds really difficult. I'm sorry. It sounds really stressful. It sounds like, it is a big deal. You can provide me with support. You can also say, have you talked to Jose in environmental? Maybe he can help you track it down, look into lost and found, think about ways to improve the labeling so Kathy's slippers don't go missing. So you can have it be such a great opportunity for peer support and also to deal with issues that arise. So Cynthia's pointing out that her nursing home is a separate support group for families to deal with some of these issues because they don't want the specifics to be brought up in the bigger family council. Some councils also, or homes, have that set up as well. So while we say most councils will do sort of formal peer support, usually they leave a chunk of time at the beginning or end of a meeting for open sharing, just for people to talk through what's happening. Some homes do have a separate peer support group. There's a home that we had speak at our November virtual conference, a City of Toronto run municipal home that has a separate peer support group that's facilitated by a social worker, so that families have an opportunity to have somewhere to bring that. What's great is the home did it in collaboration with the family council. So the family council and the home leadership worked together on this, recognizing that families needed more support than they could get through the council, and came up with a solution. So it's still that they, are supporting families with peer support, but there's another opportunity for those who need a little bit more. And I'm going to go through a couple more benefits, and then I'm going to break for some more questions for the attendees. So I also mentioned supporting the transition to long-term care, that hidden knowledge, addressing issues. It also gives families a way to remain involved with the care of their loved one. It may not be direct care anymore, which people can struggle with giving up that hands-on caregiving, but it's still a way to improve their loved one's experience. And because family council members come from all walks of life, they bring their professional lived experience to improve the home. There are council members who have worked in human resources, who have been nurses or teachers, or have skills that they can continue to contribute just in a new setting. And it does reduce stress and build relationships. So I said you facilitate relationships between administration and families, put on activities within the home, do some problem solving, could be entertainment. There was a council that their big accomplishment was they worked with the home to ensure there was a continuous sidewalk around the home so that people could walk safely and they could go out and enjoy the outside. That was actually an incredible thing that made a huge difference to those residents and families. The sidewalk. And the home was like, oh, but you can just go onto the driveway and around. It's like, no, that's not safe. They were able to do that. Engaging in partnerships, engaging in advocacy. So that's a big thing for our councils, is internal and external advocacy. So internally, working on shared issues, discussing concerns, coming up with new ideas for addressing things. The council can be a sounding board for feedback on new policies and procedures within the home. External could be things like within the community, city, region, or province, on quality improvement, on government policy, on municipal issues. There was another home kind of close to where I live, where one of their big issues was that there wasn't a bus stop directly in front of the home. So if someone was taking public transit and was coming to visit the home, say as a caregiver, a student, or a home staff, the next bus stop was a bit of a hike, and especially during the winter. It was really uncomfortable for people. So council worked with the home and the municipality to say, we don't need a new bus route. All we want is a stop in front of the home. And they got it done. And it made a huge difference to people. This, like the sidewalk, the bus stop, those are tangible things that can make a big difference. And also so many other things that councils can do. And I'd be happy to talk through more examples. But I know that Janine, you've got some questions from the attendees. So we've got time to do some of that.
We do. And thank you for that, Sam. Thank you for sharing what looks like something that we can attain here in the United States. And I agree with you. You can make differences as a family council in your home. In my dad's nursing home, we were able to bring in hospice. It took us 2.5 years to get it in, but we got it in. Before then, they had only offered comfort care. We've met with legislators about our family council and our concerns. So that's something that we learned as a family council, as a group. We learned that all federal, except for the president, all federal legislators are voted on locally, and that we can make a difference as individuals, especially when we pair together as a group. We've got some great questions from some of the registrants today, and Sam, I love your presentation. Thank you so much for sharing what makes so much sense and what we can work to achieve here in the United States. One of our registrants and attendees asked, how are other family councils funding programs and supplies?
Okay, so that is a very good question. So in Ontario, family councils only fundraise for items the homes are not required to provide. So for example, in Ontario, it would be vastly inappropriate and likely a complaint to the provincial government if a council were asked to fundraise for things like incontinence briefs, because those homes provide those. Or if a council were asked to pitch in for like the food budget, not appropriate. If a home has to provide it, they provide it. They are funded to do that. Let's say though, a council were to be doing hybrid or Zoom meetings. So there isn't any direct funding for family councils in Ontario, either through us or the provincial government. So they'll either work with the home to access some funds out of what the home has for non-direct care things, usually out of a recreation budget. Or councils will pool together funds for some low-cost items. Maybe they're going to print a brochure that they're going to give out at a local seniors fair or for a Zoom license or what have you. Or, so that's for like council operations. If they were going to fundraise for like running an event, something like that, let's say they wanted to do a Mother's Day or Father's Day event, they may solicit funds from the other families in the home or work with the residents council if it's something of like a shared opportunity. Councils aren't charities, so they can't issue tax receipts, but they could solicit some funds, do some mild fundraising to support their activities or their initiatives. But again, nothing that the home is required to provide.
Thank you for that. Good to know. There is another question that another one of our participants asked. How do you encourage participation in a family council? And if I may, Sam, I just want to jump in. and answer this one if I could. The way Gloria and I have been doing it, we watched a video that we find very impactful. It is called Strength in Numbers. I'll put the link in the notes in the chat for you to check out. It's short, it's on YouTube, it's dated, but it's very impactful, and it answers that question. Why a family council? Why should I get involved? And we find it really impactful when we share it with people that we're talking with about setting up a family council in their long-term care residence. I share it with new members of my dad's family council whenever we meet someone, because it's a question that most people don't understand. By you joining a family council, opening your mouth, advocating for not only your loved one, but you're advocating for every resident living in that home with your loved one, you become an advocate. You are advocating for people who don't have a voice for themselves, who aren't able to open up their mouths and defend themselves or advocate for themselves. So being in a family council is really, really important. I think many people think there's going to be work involved. The only work involved is really your passion to the mission, to being resident-centered and resident-driven. Just improving and maintaining the quality of life for residents in long-term care. That's family council, to me, 101. Just do for other people that you would like done for yourself when you get to be that age, if you should find yourself living in a long-term care home.
Yeah, and what we say is very much that it's a way to stay connected in the life of your loved one, to use your skills, your passion, your expertise to improve this new community your loved one's a part of, and to create a better system in the future. We're never going to make things better if we don't start now. It'll be too late for me if I need long-term care when I'm 65. I need to do it now. I need to ensure that homes have good Wi-Fi for people now, for people my mom's age, for me, if I need long-term care, because systems move slowly, but systems are built by us. So the systems that exist in long-term care have been built by people, so we can change them, we can improve them. So that's part of what we emphasize is you do have the ability to advocate for better, and you do have skills, passion, and knowledge that you can bring to that. And we also, something else that we say with, effective family councils, why should you join, is make it a good experience for people. Don't make it just a complaint session. No one wants to sit through 90 minutes of people complaining. Complaints are valuable because they help us identify what we can do better, but also focus on how we're working. We've got the why, we've got the who, but the how is also really important, because how allows us to maintain the momentum that we need to create that change. The how helps us identify, it doesn't have to be a lot of work. Here's how we can split up the work. Here's how we can work together. So really focus on making your meetings, your work, a good experience for people. And then, you're going to have some conflict from time to time when things do get a little tense. You've already built this group of people who care about each other and who respect the system and the process, so that way we can work together effectively.
Thank you, Sam. And we've got two good questions from Sandy Hall.
Yep.
Sandy Hall, go ahead, Sam.
So how does the family council find out when a new resident is admitted? So in Ontario, the home, it'd be considered personal health information. So the home wouldn't give it out to the council, except where there's expressed consent. So what usually happens is there's a couple different ways to do it, but it all boils down to getting expressed permission for the home to share that information with the council. What we advise is either the home builds it into their admission process. So let's say I'm a new family member, at some point on that day of paperwork, the person doing admission says, we have a family council, this is what they do. Do you give me permission to share the contact information with Janine, the chair of the council? Janine will use your contact information to follow up with you within a week or two. That's usually it. Sometimes there's just a form to fill out where the home gets like a signature for that, but either way, express permission. So that's the best way, is to build it in as part of the process. Most of the homes do that here because they know how important it is for councils to be able to support new members, new family members, and to encourage them to join the council.
Okay, thank you for that. And that's, you know, Sandy Hall, if you are looking to fund your family council, fund it, hold a bake sale, do
Yeah.
something. That's part of the pleasure of being in a family council and being able to meet with them. Ask questions. If you want to raise funds, go for it. A family council isn't a paid position. So whatever you would like to do, and if it requires funding, that's something that all the family members can do together or within a committee, as a
Yep.
committee within the council. If you want to have a food committee or an outing committee, a recreational committee, it's your family council. You have that right to do that. Charles is asking, go ahead, I'm sorry.
I was gonna say for the sidewalk issue, that was, the council worked with the home to identify, basically prioritizing it as a capital project, that homes have plans for capital, investments in the physical infrastructure. And council's like, this needs to be a priority because of this, and this. And the home, understood and was able to prioritize that. That was the value of the partnership and working together effectively.
Correct.
And that's good. Go ahead, Gloria.
No, that's exactly where you want to work towards, that partnership, right?
And it's not going to be overnight. It's something that, it's still taking us 4 years to do in my dad's family council, and it's still a challenge. You will be recognized though through your deeds, the effectiveness of your family council, and in the quality that you bring to residents' lives. Just show up, be on the premises, smile, talk about your family council, talk about the things that your family council has been able to accomplish as a family council. Get people as excited about your family council as you are, because excitement and happiness is infectious. It really is.
Yeah, lead by example. Like, be the change you want to be in the world. Sounds, optimistic and a little airy-fairy.
Exactly.
But family councils do that. They lead by example. They make change. You can check out more on our website about the history of what councils have done. We have some e-learnings around the council fundamentals, how to do different things. The legislation, you have to sort of substitute in your mind what's relevant to you, but the best practices are there. And our resources, while they were designed for the Ontario context, are available to everyone. So check out our website. You can see the link to our YouTube channel where we've got tons of videos from previous webinars and conferences. Check it out. My email address is there. Feel free to reach out and continue doing the amazing work that you're doing. There's actually just one question that I think I missed that I wanted to answer quickly before we wrap up, was about ombudsman in Ontario and how that connects. We don't have the same ombudsman framework as you do. So we have two in Ontario. One is a specific patient ombudsman for things like long-term care homes and hospitals. And then another is provincial for government services. So in neither case do they work directly with patient groups like family councils. They deal with complaints in order to achieve a fair outcome. But it's not the same as it seems like you folks have. Our ombudsmen are very much arm's length for investigations and recommendations to help the system do better. But you can also find out lots about them online, or just Google or do a search for ombudsman on our website and you'll find out more about our context.
Thank you for that.
Thank
We're going to, I know we received way more questions that we were able to answer today. Gloria and I are going to reach out to those questions, the people who placed them, because we have your email addresses, of course. And we'll answer those questions for you. And please take our survey. We're looking for feedback from family members and ombudsman, how to better improve our programming, to answer your questions, tackle your questions and challenges, and to help build as many, if not more, family councils as they have in Ontario. That is a really cool challenge. And the work that you're doing, Sam, is so amazing and spectacular. It's something that I personally want to work towards.
Well, thanks so much for the opportunity to speak with you folks today. Feel free to reach out and I'd be happy to help you on your journey.
Thank you, Sam.
Thank you,
So
Sam.
appreciative. Thank you.
Thanks.
Thanks, everyone.
And thanks everyone for joining us.